Hi, this is Congressman Joe Courtney, back with you again, going over some of the most frequently asked questions regarding the health care bill, which is being debated in Congress this week. I have a letter here from Mike in Glastonbury. I am hearing that illegal aliens would get free health care. I hope this is false. Mike, I can assure you that, in fact, it is false. Under existing law today, illegal aliens are not eligible for coverage under public programs such as Medicare and Medicaid. There is one small exception in Medicaid for emergency room admissions for, let's say, a heart attack that shows up at Manchester Hospital near your community. It would be unfair to the hospital, which is obligated as a charitable institution to provide care for an individual in that circumstance, to deny them payments. But other than that, there is absolutely no instances where illegal aliens are entitled to any coverage with public dollars under existing law. The bill before us would extend that prohibition. It makes it clear that in Section 341 of the bill, that any affordability premium credits, any credits to help individuals pay for health insurance in the purchasing exchange, which will go online in 2013, will be barred for individuals who are not here legally. We also have some strengthened screening systems that are being put into the bill to make sure that anyone applying for credits will have to, in fact, document that they are, in fact, here in the country legally. In addition, we also make sure that the prohibitions on federal coverage through Medicare and Medicaid is extended into the CHIP program, the SCHIP program for children's health insurance. And again, the section that covers that issue, Section 1786, clarifies once again that individuals who are not here legally are not covered under Medicare and Medicaid. Our next question is from Randall in West Suffield. A good, healthy debate should ensure that a good, healthy bill will be passed. And certainly that's what's happened over the last 11 months in this country with vigorous debate and probably one of the most transparent discussions of legislation that I've ever witnessed as somebody who was in the state legislature for 8 years and had been in Congress for 3 years. But there is one thing that is not debatable. The health care system reform plans being proposed in the Senate would build on Medicare as a foundation, and that foundation is crumbling because of an archaic payment system. I firmly believe that in order for health system reform to succeed, Congress must eliminate Medicare's sustainable growth rate formula, the SGR formula. Well, Randall, I completely agree with you. You are right. The payment system, which was passed in 1996, set up this so-called sustainable growth rate, which every year has imposed an automatic across-the-board fee cut to Medicare physicians and providers. And every year, doctors have had to come down to Congress and beg to avoid those cuts from going into effect. This year, the sustainable growth rate formula, if left unchanged, will result in a 21% across-the-board cut to physician fees under the sustainable growth rate formula. When we take up the health care bill, we will also take up at the same time H.R. 3961, which will permanently abolish the sustainable growth rate formula. That's why the American Medical Association yesterday, November 5th, came out and endorsed the House bills under consideration, H.R. 3962 and H.R. 3961. This is a huge development to have AMA's now complete full-throated endorsement, along with the American Academy of Family Physicians, American Academy of College, the American College of Surgeons, OBGYNs, the American Nursing Associations. I mean, a whole litany of provider groups now that have come out strongly in support of the House bill. You can get that list of endorsements at my website. And again, one of the primary reasons, as Randall indicates, is because it is abolishing a system which has created great instability and uncertainty around the Medicare system and has really undermined physician participation in the program. I have a question from John from Preston. He thinks that Congressman should poll his district on an issue and then vote exactly as his or her district decides. Wants Joe to vote according to what his constituents tell him. Well, John, I will tell you this. I have made a unstinting effort to go out in the form of town hall meetings. We've had online chats, webcam interviews at the Norwich Bulletin, and certainly we've had a high volume of email and traffic in our office just through regular, ordinary correspondence. There are high passions surrounding this legislation. There are specific issues issues that people are very concerned about. For instance, seniors are concerned about their Medicare Advantage program, and this bill makes it very clear that Medicare Advantage will continue to exist, and in fact will be subject or able to receive bonus payments for programs like HealthNet or Aetna's Medicare Advantage program. And once we have been able to walk through with seniors that in fact, we are protecting Medicare Advantage. Some of the concern calls that have come in have now shifted to support for the legislation. Again, yesterday, AARP, an organization that represents 40 million retirees and senior citizens across the country, after evaluating H.R. 3962 and seeing that we are eliminating the donut hole, the outrageous 100% deductible that seniors have to pay as part of a benefit plan that was botched when it was enacted back in 2003. Again, we now have the full support of AARP because they have evaluated the impact on the Medicare program and have concluded that, in fact, it will strengthen Medicare and improve the benefit structure. We don't poll, you know, as members of Congress using taxpayer funds. I mean, obviously that's a controversial issue in Connecticut right now at the state level, but we don't poll with taxpayer funds because, frankly, I don't think that's an appropriate use of taxpayer money. But certainly my job is to be out there talking to individuals, and yesterday we had a number of folks who have great concerns that came and visited my office. They were part of the protesters that came to Washington, D.C. I've been willing to talk to people both in favor and opposed to the health care bill, and you know, my job is really to evaluate those concerns, to address them as best as we possibly can, read the bill, which we've done, and then cast my vote in the manner that I think is in the best interest of our district. I did that when we had the Wall Street bailout in October of 2008. I was the only member of Congress from Connecticut to vote against that measure because I felt, after reading the bill, receiving 4,000 phone calls of people on both sides of the issue, listening to their concerns, that I didn't think it was a plan that protected the taxpayer and held the big Wall Street firms accountable. I still have people who are very upset with me for voting against that measure, but I stand by that vote. And I'm certainly a public official who understands that you know, these are actions that I take where I'm going to be held accountable. So again, John, I want to reassure you that we have been engaged and listening to people in the district, and we have responded to a lot of their concerns with the redraft of the bill that we'll be voting on later this week. And but certainly we won't be using actual taxpayer dollars to conduct polls, but I do think at the end of the day, you know, we've pushed this process in a direction that's better for Eastern Connecticut. Thank you for your emails and letters, and we look forward to continuing this discussion and dialogue over the next week or so.